You are listening to 30 Stories, a podcast from the THANC Foundation. I'm Jesse Fisher. I'm the Director of Communications at the THANC Foundation, and I'm really glad you're here. If you found your way to this episode, there's a good chance cancer has touched your life in some way. Maybe you're a patient, maybe you're a caregiver, maybe you're supporting someone you love. Wherever you are, this space is for you. This podcast is an extension of our 30 Stories in 30 Days campaign. At its core, 30 Stories is about real people sharing real experiences with thyroid, oral and head and neck cancers. These conversations do not offer medical advice. They are not polished success stories. They are honest reflections from people who have lived through diagnosis, treatment, recovery, and everything in between. Each episode, you'll join me as I sit down with someone who has been there and is willing to share what they learned along the way. We share one story a day during 2 awareness months: September for Thyroid Cancer Awareness Month and April for Oral Head and Neck Cancer Awareness Month. The goal is simple: to help people feel less alone by hearing from others who truly understand what this journey can feel like. This podcast allows us to slow those stories down and hear the voices behind them. This podcast is for patients navigating diagnosis, treatment, or survivorship. It's for caregivers who support someone they love, often putting themselves second. And it's also for advocates, clinicians, and supporters who want to better understand the human side of cancer care. You do not need to be at any specific stage to listen. You just need to show up as you are. In each episode, you'll hear an open conversation about what this experience was really like. The hard moments, the unexpected lessons, things our guests wish they had known earlier. And there's no pressure here to feel inspired or optimistic. Hope is simply that something you hear makes you feel understood. In this episode, Jennifer shares what it feels like to know something was wrong before anyone else did. Her story is about instinct, persistence, and the quiet strength it takes to keep pushing for answers. It's also a moving reminder that survival is not the end of the story. So much for joining me today. How are you?
I'm doing really well. Thank you for having me. It's so nice to meet you face to face.
You as well. Tell people more about yourself. What is your background? What are things that you like doing? Yeah.
Sure. I am a mom to 4 grown sons. They live in different countries now. I only have one left residing in Canada. 2 are now American citizens, and 1 lives in Australia. So it gives me opportunities to travel and see places where I may not ordinarily go. I'm a dental hygienist by profession. I have been a registered dental hygienist in Canada since 2007. And I'm also a stage 4 HPV-mediated tonsil cancer survivor. I will be 12 years cancer-free this coming June.
That's amazing. Well, congratulations on the 12 years.
Thank you. I enjoy spending a lot of time outdoors, and I have 2 little dogs that weigh 4 pounds each. They keep me company and are my constant companions.
You're a 12-year cancer survivor, coming up on 12 years. What was something you first noticed in the initial, before diagnosis, obviously? What was something that just a persistent symptom or whatever caused you to seek out medical help?
So as a dental hygienist, I was first and foremost trained in college to do thorough intra and extra-oral screenings on every patient, every visit. And I had been across the border in Buffalo shopping for the long weekend in September of 2013. And on the way home, I had a sensation on my neck, and I reached up to scratch it, and I discovered a mass on my neck. I'm pretty conscious of my overall face when I look in the mirror, and I'm pretty sure that it wasn't there the day before. And when I felt it and as I palpated it, I observed that it was fixed, painless, and kind of felt like the texture of an almost perfectly ripe avocado. And it was about the size of a quail egg. I had no other symptoms. I didn't have a fever. I didn't have a sore throat. I had noticed I was always a kettle corn eater, and I had noticed that I had felt like clearing my throat a lot in the previous couple of weeks, almost like maybe I had a popcorn hull stuck in the back of my throat, but I didn't think anything of it until I found that lump. A couple of weeks before I found the lump, I was visiting friends, and they had an elderly dog that had several tumors on her body. And she wasn't in a lot of pain, but I was fascinated by these tumors on her body. And I sat on the floor for a few minutes playing with her and stroking her head and palpating one of the tumors that was in her shoulder. And I got to know that tumor very well, feeling the edges and feeling the texture of it. And as soon as I felt the lump on my neck, my heart dropped into my stomach. It was unmistakable. And I knew right then that it was cancer. And so I was on the QEW driving back to Toronto in long weekend traffic, and I recognized that I couldn't get caught up in this at the moment. I had to focus, so I cranked up some Matchbox 20 on the stereo and just got lost in the music and tried to drown out my thoughts as I drove home. And so that was the first thing that I noticed.
It's a difficult drive. Just and thinking that and your unique perspective to your background as a dental hygienist and yeah, that's quite a shock.
For my official diagnosis, once I had argued with doctors and specialists for over 3 months, was squamous cell carcinoma. And then with further scans and from the biopsy, they were able to tell that it was P16 HPV mediated oropharynx cancer.
Okay. And what was that 3 months leading up to that diagnosis like? That sounds fraught.
It was awful. I started when I got home from that shopping trip in the US. The following morning was a Tuesday, and I called my family doctor's office immediately and requested an emergency visit to see him. I wasn't able to go in until the next day because he was triple booked. And it's often the case here in Canada with family doctors. We have quite a shortage going on. And so I went in to see him, and he felt the lump on my neck, which I showed him, which was visible to the naked eye. You could see that it was a unilateral mass. And he asked me a battery of questions about my ears, my nose, and my throat, if I'd had any chills from a fever. And he looked down my throat with a light and a tongue depressor, and he didn't see anything. And I assured him that I felt physically well. There was no virus. This was cancer, and I needed this pursued with further tests. And I think he thought I was catastrophizing. So he was kind of placating and said, you've got to give it a couple of weeks. If it hasn't resolved within 2 weeks, I want you to come back. 14 days later, I went back to his office. I said, still not sick, lump still here. What are the next steps? And so he ordered an ultrasound and sent off a referral for an ENT in my area. I went for the ultrasound, and I spoke to the lab tech performing the ultrasound. And I said to her, can you tell me what you see? And she said, well, that's not up to me. You're going to have to wait for the report from the radiologist. And so I explained to her that I'm an oral healthcare provider and that I know a lot about head and neck lesions, and that I was very concerned that this was cancer. And she told me that it looked like a liquid-filled cyst. She said, I've seen a lot of cancer. This doesn't look like cancer to me, but I'm going to have the radiologist look at this immediately. Stay put, and I'll come back. And so she took the ultrasound and had the radiologist examine it. And they said that it looked like a liquid-filled cyst, and they had done the measurements on it. And he sent off his report to my family doctor. In the meantime, I went and saw the ENT, and he ran a lighted scope up my nose and down my throat. I told him everything that had been going on, and he didn't see anything in my throat, even though I told him where it felt like I had a popcorn hull stuck in between the tonsillar pillars on the right side near the base of the tongue. He looked, he didn't see anything, and he asked if he could do a fine needle aspiration of the lump in my neck. And so I agreed to that. And as he inserted the needle and began to draw the fluid out, it was just a clear straw-like fluid. And he sent that off to pathology. The next day, I woke up and the lump was red and it was hot and I was shivering, and I realized that I had a localized infection. And so I went right back into his office and was put onto antibiotics. While I waited for the pathology report for that 10 days, I saw the report from the radiologist from the ultrasound at the hospital. And sure enough, they had said that it looked like a liquid-filled cyst. But his recommendation at the bottom of the report was that a CT scan with a contrast dye be ordered. That test was never ordered. And so I went back to see the ENT after 10 days, and the pathology report from the fine needle aspiration was inconclusive. And so it just showed mixed inflammatory cells. And so he wanted to repeat that test. And I said, okay, this was not being done under ultrasound, just in office with his naked eye. And so he went after the lump again with a fine needle cannula and tried to withdraw more fluid. This time, the fluid that came out was tinged with blood, so it was pink, and there was definitely some exudate or pus mixed in with that fluid. And he once again sent that off for pathology. And he kept trying to reassure me that this wasn't cancer when I knew it was. I had this inside voice that was screaming in my head at this point as we were getting through the month of November. And I knew what was going on, and I felt like nobody was listening to me. And so 10 days later, the pathology once again came back inconclusive. And so this was towards, I guess, almost the last week in November. And the ENT told me, he said, I believe that what this is a brachial cleft cyst type 2, and I would like to book surgery for you to remove it. And I had done some research on what causes neck lumps, and I already knew that that diagnosis would only make sense if I were 12 years old. That lump didn't just show up at 46 years old and be what he was describing. And so I said, are you sure? And he said, oh, I'm pretty confident. And I said, I wasn't convinced at all, but who am I to argue with someone that does this for a living and deals with these kinds of lumps? And so he booked me for a surgery that wouldn't take place until May of 2014. And I left the office feeling just kind of hopeless. Like, what am I going to do? Who am I going to approach with this next? Because I'm not getting the answers that I know are correct. And I just couldn't shake the feeling inside my gut. And so I continued working. I specialized in orthodontics, not in cleaning teeth. And so I went back to work, and the feeling started to get a little stronger, that sensation of a popcorn hull stuck in my throat. And so I requested that my boss go down my throat with an intraoral camera and see if he could see anything and snap some pictures. And I looked on the screen and I thought, it is visible. It looked like a hemorrhoid right where my right tonsil should be. And I knew that wasn't normal anatomy. And so the following day, I was working at my other office, which was close to where that ENT was. And so my boss put those pictures on a USB stick for me. And on my lunch hour, I drove over to the ENT's office, and I was so frustrated, I didn't even call ahead. I showed up on my lunch hour, and I went in, and I told the receptionist that I needed to see this doctor. And she said, we're not open right now. It's lunchtime, and you have to call ahead and make an appointment. And she was elderly and really cranky with me. And I said, no, you don't understand. I've been misdiagnosed. I have pictures on a stick of what I'm talking about. And I started to get a little louder. And so the ENT came out of his office where he was eating lunch and he calmed the receptionist down and said, it's okay, I'll see Jennifer. And he took me back into the consult room. And I told him, I said, my boss went down my throat and took pictures of what I've been talking about. And I have pictures on a stick. I said, would you like to view those pictures or would you like to scope me? And I said, it's tucked right behind the anterior tonsillar pillar on the right side. And he said, no, I'll scope you. And so once again, he ran the lighted camera up my nose and down my throat. And when he pulled it out, his whole demeanor shifted. And he said, it doesn't look like cancer, but it doesn't look normal. Now you've got me worried. And so he called out to the nurse in his office to prepare the surgical suite in the back of the office. And so I knew the pathology would take about 10 days to come back. And this was at the beginning of December now. And I was hoping the pathology would come back prior to the offices all closing down for 2 weeks over the Christmas holidays. I had booked a trip to take my children to Florida over the holidays because I knew that something was coming that wasn't going to be favorable. And so after he snipped the chunks of tissue out of my throat, I left his office and I had to go back to work, which in hindsight was really foolish. I was definitely in shock. I was trembling and crying and bleeding from the mouth, but I had a couple of Invisalign patients that I had to bond attachments on that afternoon. So I went back to work and I almost feel like, I don't know if you remember the Charlie Brown cartoons, but there was that little character Linus that would walk around with his blanket and you could just see the attitude in the aura around him. I felt like that's how I presented myself at work. None of my coworkers would come near me or ask me any questions. They could tell that I was upset about something. And I think they thought that I would just turn into a puddle on the floor if they even spoke to me or acknowledged anything. So I managed to get through my first patient, and that ended up being the only patient that I saw that afternoon. What would normally be a 45-minute appointment took me almost 3 hours to complete because my hands were shaking so bad. And so I ended up continuing to work until it was time to leave for Florida with my 4 sons and my daughter-in-law. And we went to Fort Myers over the holidays for about 10 days. And on December 23rd, we were sitting outside by the swimming pool at the resort. There were several guests around the pool as well. And my phone rang, my cell phone rang. It was sitting beside the pool. And I reached over. It was so eerie. The whole pool went silent. Even the other guests who didn't even know me were dead silent. It's like everyone could feel that something was in the air. And I answered the phone and it was the ENT. And he said, hi, Jennifer, it's Dr. So-and-so. He said, what are you doing right now? I said, I'm in a bikini in the sunshine drinking a cerveza. And I have a feeling you're about to rain on my sunshine. And he said, I got the pathology results back. And he said, it's squamous cell carcinoma. And I just let out a big breath. I said, I knew it. And he apologized and said, I know you did. I said, no, I seriously knew it. I said, this was my life. This is cancer, and you were missing it. And he said, I am so, so sorry. And I asked him what the next steps would be. And he said that he would put in a referral for me to see a radiation oncologist at one of the university hospitals in Toronto for when I returned. And he apologized again. And he told me 4 times during that conversation, he said, you have to stay positive. Above all things, you must stay positive. And so I went home with my children and started the process of seeing many doctors. For me, I was strongly opposed to having chemotherapy, not because I'm against chemotherapy in general, but because once again, what I call my spidey senses were tingling, telling me that that wasn't going to be the right fit just for me. I had read about the chemotherapy that was used for this type of cancer, and something about it set off my alarm bells. And so the first specialist I saw was a radiation oncologist. And she went through the treatment protocol with me and assured me that the gold standard was chemo and radiation. And I had a lot of questions. I had done a lot of research, and she had mentioned to me that she thought that my cancer might be HPV mediated. And we were right at the beginning of the onslaught of the HPV head and neck cancers. I was kind of at the forefront of what is now this global epidemic. And I told her, I said, I'm not having chemo. I want surgery. And she said, you won't be a candidate for surgery. And I said, well, why not? And she said, because they will split your mandible, your lower jaw, open your face to access the tumor. And there's a good chance that you will lose the ability to speak or swallow. And I said, what about a transoral robotic laser surgery? And her eyes got really big. I said, listen, I was watching something about this on YouTube, about this procedure that's being performed in Europe. Who do I talk to about that? And she said, you won't be a candidate for surgery. And she started to get annoyed with me. And I said, I really feel strongly that I don't want chemo. And I asked her a bunch more questions about the chemo and about the radiation. And she said, at some point, you have to stop asking me questions and just trust me. And I stood up and I said, I appreciate your time. And I'm sorry, this relationship is not going to work out. And I broke up with her. And I emailed an oral pathologist that I knew that worked at that same hospital. And he actually called a friend of his who is a head and neck surgeon at that hospital. And I made an appointment and went in to see him. And the surgeon sat down with me and he explained that although chemo and radiation is the gold standard treatment for the type of cancer that I had, he felt that I might be the perfect candidate for a transoral robotic laser surgery, which was what I wanted. He said it's still highly controversial, but I feel that it may offer you almost the same odds as if you had chemo and radiation, if you had this surgery followed by radiation. And he said, I would love to do your surgery for you. Unfortunately, I don't have a robot, but I know someone who does. And he made a phone call from his cell phone. And an hour and a half later, I was downtown at the Princess Margaret in consult with who would become my quarterback. And his name was Dr. John D. Almeida. Wonderful guy, most intelligent, humble, compassionate human being I think I've ever met. And so when I met him for that initial consult, I asked him how many of these procedures he had done so far, as I knew that he was pioneering this surgery at the time. And he assured me he had done more than anyone else in the country. And he said it with such confidence, but I pushed a little further and I said, how many? And he said, 50. So I knew that it was really, cutting edge. And he had to order a few more scans to make sure that I was indeed a candidate for this surgery, which he did. And then I met with him again 2 weeks later, and after the holidays and everything had gone by, and he assured me that I indeed was a candidate for this surgery, a good candidate for it. And he explained all of the risks to me, and I was so happy to sign off on that informed consent form. And I also met a new radiation oncologist at Princess Margaret who was much nicer and willing to answer my questions. They were all, I just felt that I was treated really, really well and that my concerns were heard. And they spoke to me as a fellow healthcare provider, not someone who didn't know what she was talking about. And so I had a transoral robotic laser surgery on January 30th of 2014.
That's amazing. And especially at that point in time, like you said, it was very cutting edge at that time.
I don't even know how I knew to look that up. I don't even remember how that came about, but as soon as I read it and watched a video on it, I knew that's what I wanted.
Yeah. Thank goodness for the algorithm, I guess, at that point in time.
Yeah, I'm so grateful
Um,
for my spidey senses. They now run my life.
yeah. And your self-advocacy is like key, I think, super important to listen to yourself and to advocate for yourself. I think that's a really great.
The thing of it is, it can be really intimidating for lay people that are not involved in healthcare to go in and sometimes, we can all get a little bit of white coat syndrome. I have a nephew who's a double specialist, and my youngest son is now a doctor. And at the end of the day, what people in the public sector need to realize is that we're all just people. And no matter your degrees, none of us get it right all the time. And each person is biologically and genetically different. And I think that it's really important, if something you're hearing is not aligned with what you're feeling is your truth inside, you need to be able to express that. And healthcare providers need to give you the opportunity to express that and discuss it.
Mhm. Absolutely. Absolutely. What was your treatment after that? So you had the robotic surgery and you had
Yes.
radiation treatments. What was recovery like from the surgery? How soon did you start radiation afterward?
So I had the transoral robotic laser surgery where my surgeon removed about a baseball-sized mass of tissue out of the back of my throat, including a section of my posterior tongue. And then he did a neck dissection and removed 26 lymph nodes. I ended up being in hospital. He estimated that I would be in the hospital for about a week. I was actually hospitalized for 18 days. It took me a little longer to recover than what he anticipated. And so then I was given 6 weeks to heal up from the surgery. And then they took me in to do my appointment to make my radiation mask and do a CT scan with the mask on, so the scientists and the radiation oncologist could plan my radiation treatment. And they were going to schedule me for 30 sessions of IMRT. And with that CAT scan, when they made my initial mask, apparently something showed up on that CAT scan, which I wasn't aware of yet, but I was back at the hospital getting some other tests done. And although I had no more enlarged lymph nodes in my neck, my spidey senses started to tingle again. This was in March, and it was over March break, and I hadn't started my radiation therapy yet, but I just couldn't shake this feeling once again. And I didn't really understand what the feeling was, but I just felt like something was wrong. So I called upstairs to my surgical oncologist's office, and I spoke to the receptionist, and I said, something's wrong. I don't know what it is, but I need to get in to see Dr. D. Almeida. Is he in clinic today? She said, he's actually not even in the hospital. He's on holidays this week. But the surgeon who assisted him for your surgery is here. Come on up and I'll fit you in and I'll have him see you. So I went up, and when I was called into the consult room, I let that doctor know what I was experiencing. And he pulled up the results from the CT scan that was done for my radiation planning appointment. And he was quite a quiet guy. And he was kind of mumbling and saying something about a lymph node. And he said something about a fine needle aspiration. And I didn't really understand what he was talking about. It was like he was talking to himself out loud rather than talking to me. And then his cell phone rang. So he exited the consult room. And when he came back in, he said, that was Dr. D. Almeida that called me. He actually is going to come into the hospital and wants to see you personally. And so if you can just have a seat in the waiting room, he should be here within about a half an hour. And so I went back out to the waiting room, and then my surgeon came in and called me in. And he said, I saw your CT from your planning appointment, and there are 2 more lymph nodes that are now enlarged. And he said, I would like to go back in and do just a limited neck dissection. I'll excise the same scar, and I would like to remove those lymph nodes before we send you to radiation. And 100% I'm on board with Heal with Steel. For me personally, I feel if you can cut the whole cancer right out of your body before you have any other treatment, for me, I felt that would give me the best chance of survival. And so I agreed to the limited neck dissection. He booked the surgery, and I guess I had that surgery probably, I think it was the middle of March of 2014. And he came into my room the next morning after the surgery, and he said, I ended up removing 4 more lymph nodes, which took me to a total of 30 that were surgically removed. And he also took my right submandibular salivary gland. And he said, we've got to wait for pathology. He said, if I was a betting man after removing those, I would say that those lymph nodes were probably just reactive and not cancerous, but we'll have to wait for the pathology. And so I had to wait the 10 days, and then I went to his office to see him. And when he came in, I had gone to the hospital by myself that day because I thought that this was going to be simple. I wasn't anticipating that anything would be wrong with those lymph nodes. Like he said, they were likely just reactive. And when I went in, I sat down, and when he entered the consult room, he looked quite serious. And usually he would joke around and was very personable with me. By this point, we had built, a pretty good rapport because I'd seen him so many times. And I asked what happened with the pathology report, and he said that he was completely surprised, but 2 more of those lymph nodes were cancerous. He said my submandibular gland was full of chronic infection, but no cancer. And I let out a sigh because I knew that changed my staging. And I asked him what stage I now was. And he said, stage 4, with 3 positive nodes on one side. And that just hit me so hard. I burst into tears. He closed both doors to the consult room and pulled his chair right up beside mine and held his arms open and hugged me until I was done crying. And it's a good thing because I was there all by myself. So like, I get a little bit emotional just thinking back to how that felt. Being told I had stage 4 cancer actually gave me a new diagnosis of PTSD as well. So now I was not only going to be battling the side effects of treatment, but also what would become a very deep depression and an anxiety disorder that would follow me for the first decade post-treatment. Now that the cancerous lymph nodes were all gone, I had to go back for another planning appointment where they had to fashion me a new radiation mask because my anatomy had changed once again. And then I began radiation treatment in April, and I completed all 30 sessions at a reduced dose because my surgeon had obtained clear margins. But a couple of those margins in my throat had been a little closer than he would like. Even though they were clean, he still advised that I go forward with the radiation treatment. And so I completed the 30 sessions of IMRT. And then it took me about a year to recover. My recovery was not typical of most patients. And when I would go in to see my surgeon for follow-up, when he would scope my throat, he was always puzzled. He said, everyone's throat goes back to looking normal after this surgery, and especially after radiation. He said, I just don't understand what's going on. You've got these thick bands of yellow and white scar tissue, which was really impeding my ability to swallow. And I was developing huge ulcers in my mouth and at the surgical site in my throat. I ended up on oxycodone for almost 5 years because it felt like I was constantly swallowing sharp shards of glass. So that was interesting. And finally, he had done some research, and he ordered a blood test on me called an ANA test, which is your anti-nuclear antibodies, and discovered that I was Rho positive. And so I was sent to a rheumatologist, and it was found that I have the markers for several autoimmune diseases. I also have now got 4 diagnosed autoimmune diseases, one of which is a connective tissue disease. Had we have known this prior to treatment, I wouldn't have had radiation because it was contraindicated. Incidentally, so was the chemotherapy that I refused, specifically that chemotherapy. And it could have resulted in a fatal myocardial infarction. And so my gut instincts with that chemo were bang on. And so I still suffer with really bad swallowing challenges because of the bands of scar tissue in my throat. That will never go away. However, I don't worry about it because it inspired my surgeon to run a clinical study on patients going forward. And now they are pre screened for autoimmune disorders. And any that have had issues like mine, they don't get he hasn't sent them off for radiation. They've had the transoral robotic laser surgery alone, and so far none of them have had a recurrence. So at least my case inspired some change, and I am so happy for those patients. So
That's
wasn't all for
amazing.
nothing. Yeah.
No, absolutely. That was the opposite. Thank goodness for your spidey senses.
Yeah,
Um,
I know, right?
wild. Throughout this whole process, what was your support system like? Who was there with you, or what resources did you? Obviously, you have sort of a background in healthcare, so you have that sort of underlaying, foundation of understanding and knowledge. But who was there for you?
It's interesting that you say that. So I sort of have that understanding from my community of fellow healthcare providers. However, it's been my experience that people can't relate until they can actually relate. And I hope that no one I know can ever relate to what my experience has been. I to this day have people, close friends, who don't understand why I can't eat in a restaurant and why it takes me over an hour to eat my meal because of my swallowing issues there, and why I can't eat certain foods. They say to me, "Well, aren't you cured?" And I have to re-educate them and let them know that, just like when you borrow money from a financial institution and you pay that money back, you have to pay it back with interest. I didn't borrow money, but I borrowed time. And there's interest on that. There's a deficit. And due to the radiation, my deficit is compounding year upon year. And so today is the very best day of my life. And I get to say that every single day, but I'm gradually deteriorating as time goes by. And so they just can't understand because people think that once you're cured, that's it. And another component that is very important to me and something that I want to do much more work in the arena of is actual survivorship. With head and neck cancer, as you know, it boasts the highest depression and suicide rate of all cancers. And with the PTSD, I noticed that the people that stayed and were supportive were not the people that I expected to stay. The people that I thought would be the closest to me were my family and some really good friends. And a lot of those people ended up backing away. It's very interesting to me how uncomfortable this situation can make some people. They don't understand, you lived. Why are you depressed? They don't understand the isolation that head and neck cancer patients face. I ended up having a lot of psychotherapy and dealt specifically with a cognitive behavior therapist for the last probably 8 years who specializes in trauma. And I'm so thrilled to be able to say that when I finally hit the 10-year cancer-free mark, I started practicing mindful meditation and keeping a gratitude journal, and my whole trajectory mentally and emotionally started to shift, and I began to feel the light inside of me again. And I'm finally now completely off of my antidepressants and my anxiety medication, and my chart no longer says PTSD. I got to a point before the 10-year mark, just as I was approaching that anniversary, where I was in such a dark place that it came down to two choices. Either I was going to die or I was going to choose to live. And I lost one of my brothers in 2020 to suicide. And in 2018, I lost my very best friend in the whole world. It wasn't to a cancer diagnosis, it was to depression. And she was like my soul sister, and she hung herself. And I saw the ripple effect of the choices that they made and how much it hurt me and hurt their children. And I knew when I was at my very bottom that I just couldn't do that to my own four sons. I couldn't hurt them that way, whether they understood me where I was at in life right now or not. I couldn't do that to them. And so I chose to live, and I chose to change some of the things that I was doing. And now I'm completely on the other side of that depression, and I feel amazing. I'm so grateful to still be here.
That's incredible. Thank you for sharing that. But like you said, it's something that a lot of people in this community face.
I find that even with counselors, it's so specific for head and neck cancer patients compared to all other cancers. And I am connected to several survivors, and I've had the privilege of helping other people as they go through treatment. I've even identified a couple of people and sent them directly to my surgeon, and he's done their surgery for them. And it's just such a privilege to have the ability to really understand how it feels to be in their shoes and know specifically how I can help them, or to be able to listen to them and identify the areas where they need support. And that is probably the biggest component next to actually getting these cancers diagnosed to begin with. I feel that survivorship and getting people out of surviving and back into thriving is one of the components that needs the most help at this point, because almost 1 million people will be diagnosed globally this year.
Mm-hmm.
So
yeah. And finding their way back to living their life with quality and putting this in the rear view, hopefully, is, the ultimate goal. Wow. What is some advice that we kind of covered a little bit in terms of self-advocacy and things like that? But if there's any particular advice that you would give somebody just starting out, or even yourself, what advice would you have given yourself at the very beginning, now that you are sort of 12 years out?
Wow. For me personally, I feel that I needed more help with the emotional side effects of it all. So, engaging in mindfulness practice and just being very gentle with ourselves, staying grounded and connected with nature and with animals like my little dogs, where there's no pressure and no expectations on us to be any different than where we are, and just meet ourselves right where we are at, and not even put out grand expectations for ourselves, because sometimes it's just about getting through the day and having one positive to focus on at the end of the day.
That's good advice. Yeah. One thing, just focus on one positive. You see that?
Yeah. It comes down to gratitude and focusing on the things that we have to be grateful for. I find that now that I live in a constant state of gratitude, there's no room for fear and anxiety, because they can't exist inside of a person simultaneously with gratitude.
Yeah, that's so true. I really love that. I love that message. Yeah. And it's something that everybody can practice, whether you've gone through this journey or not. Something, everybody should carry with them. Gratitude. I love that. How are you feeling these days?
You know what? I feel great. I no longer worry about what is to come, because I can't control any of that. This might sound crazy, but I am actually really grateful for all of the experiences that I've had, especially the negative ones, because it's given me more insight into understanding the people in the world around me. I feel that it has made me a more well-rounded person. It's made me more kind and compassionate. And I just feel like every day is such a gift. I look forward to waking up every morning and practicing as much kindness and compassion for others whenever the opportunities arise, no matter what it's about. And I just have such a great life. I'm now going for a job interview at an ortho office this afternoon where I think things are going to really align. I'm continuing with public speaking and hopefully writing more articles. I love being on stage. Any opportunity that I have to educate fellow healthcare providers with my story seems to make a really big impact. And it's not about me. It's about all the other people that it can make a difference for. So that's what I value, is just really finding ways to serve humanity. We live in a world full of chaos and hurt. And like I said, I can't focus. I don't even watch the news because I can't give any of this gift of time that is so precious to me. I can't give it over to anything I can't control. So I focus on just making a difference for others everywhere I go. And that just fills my heart with so much happiness. I'm in such a great place.
Good. Yeah, that's great. Yeah, and that's so true. You have to use that time. It's so precious. Kind of going back to your analogy, you take that time out of the bank, but we only have so much of it. Really great. Really, really great. I'm so glad we had the time together today to talk, and for you to share your story with me.
I'm just excited about all the possibilities to come. I really value your time and what you're doing with these podcasts. And I'm so grateful that I got to meet you and talk with you today. Thank you for giving me that opportunity.
Jennifer leaves us with something lasting. Trust yourself. Keep asking questions and let gratitude make room for hope. Her story is honest, hard-won, and deeply relatable. For anyone living through diagnosis, recovery, or the long road after, this conversation is a reminder that you are not alone. If you are listening and finding pieces of your own story reflected here, please know this: there is no right or wrong way to move through this journey. If you are looking for additional support, the THANC Foundation offers several resources you may find helpful. The THANC Guide is a patient-friendly resource with clear information about diagnoses, treatments, and life after treatment. You can access the THANC Guide at thankguida.org, THANCguida.org. We also host the Voices of Wisdom podcast, which features expert-led conversations focused on clinical care and emerging research. That podcast is primarily for clinicians, but it could be helpful to anyone listening. We also regularly offer webinars and programs designed to explore a variety of topics. Past webinars have explored the clinical trial process, offered a voice to parents as they navigate cancer, discussing advancements in cancer treatments, and more. You can learn more about those webinars at thank.me/webinars. That's THANC.me/webinars. If you are interested in sharing your own story, either in writing or in this podcast format, we would love to hear from you. You can submit a story online at thankguide.org/share, or by sending an email to 30storiespodcast@gmail.com. That's 30storiespodcast@gmail.com. Every story matters, and you get to decide how and when to share it. Thank you for spending this time with us, and thank you for being a part of a community that shows again and again that no one has to face this alone.